Even with the current rise of all of the content producers on perimenopause and menopause, I feel like there's a way that it gets reduced down to hormone therapy. And it needs to be so much broader than that.
If we just slap a patch on someone and give them some oral progesterone, it's not going to fix all this other stuff. We could run all these tests, but if you have stuff you're not dealing with, women are expected to be Energizer bunnies, be selfless. The sandwich generation where I've got aging parents and teenagers, it's like they're pulled in so many different directions. It's almost like a perfect storm of burnout.
What if your symptoms, like fatigue and burnout, aren't just about stress or overwork, but your hormones waving a white flag? Progesterone down, cortisol up, HRV tanked, and your labs still normal according to your primary care doctor or gynecologist. Welcome to Treated. I'm Dr. Sara Zoll. Today we're cutting through the noise about midlife fatigue, brain fog, and burnout in women. Because the problem isn't just that you're tired, it's that we've been measuring the wrong things. My guest today, she's one of the few people changing that conversation. Cynthia is a nurse practitioner with 20 years of clinical medicine experience. Her TEDx talk on intermittent fasting has over 15 million views, and she's helped thousands of women reclaim their health span by listening to the data their bodies have been telling all along. Today, we unpack the top biomarkers that matter for women 35 and up, the ones that predict burnout before it flattens you. We talk insulin, cortisol, HRV, progesterone, and why fasting can be powerful if it's personalized. If you're in perimenopause, if you feel like your body is betraying you, and you want to learn what to actually measure, this episode is for you. Let's get into it. Welcome to Treated, Cynthia.
Thanks for having me.
Oh, so excited to go deep. What will women get from listening to us today, listening deeply? What kind of transformation can they expect?
I think a better understanding of what to anticipate as they're navigating perimenopause and menopause, and doing so from perspective that pulls from clinical experience, anecdotal information that we've garnered from working with thousands and thousands of women. And then, they might learn a little bit more about me personally, part of my personal journey, and how that's impacted who I am today.
Well, that's really what I want to get into first, because you and I have had so many conversations, not recorded, about, what got us to this point in our lives. The trials that we had, especially as children, the challenges that we've had as women with our hormones, with burnout. Have you been burned out before?
Oh, yeah. 10 years ago, completely and utterly burned out. Couldn't do more than walking for exercise for an entire year. To give people perspective.
Tell us about that, because I know you turned left from about 20 years in clinical medicine, traditional clinical medicine. Is that when you turned?
I think it was certainly, there were things that were contributing. It was a constellation of things that were happening. I think that I was feeling really misguided in traditional allopathic medicine. I had a very strong interest in the influence of food and health. And as much as my peers were supportive, this is both physicians and other nurse practitioners, I got to a point where it was clear to me that the kind of traditional model that I was working with and was no longer in alignment with where I was philosophically, emotionally, spiritually. And so I think that was a first contributor. But like most women that are navigating their early 40s, nothing had really prepared me. I'd never had a conversation with my OB, my GYN. I had not with my mother, my friends, because we kind of coexist in this space of silence. The aging process is this silent process.
It is.
And so I think that for me, so much of that journey was leaning back on principles that didn't necessarily work anymore for me. And at that time, I was doing very intense exercise, what I would consider to be CrossFit level intensity.
Okay.
I worked part-time for this very intense cardiology group where the nurse practitioners functioned incredibly independently in a hospital environment, so a lot of pressure. My husband did a lot of international travel. My boys were young. And, the not getting enough sleep, too low carbohydrate, because I had been paleo for a while, not enough recovery, add in perimenopause. And my perimenopause experience might have been exacerbated by the fact that I have underlying thin phenotype PCOS. So I was always lower on progesterone to begin with. And it started with trouble sleeping, anxiety and depression. And then the next thing kind of snowballed into weight loss resistance and just having crime scene heavy periods. And amongst all of that, I had this sudden loss of my hearing in one of my ears. It happened suddenly. And you can imagine in cardiology, when you're wearing a stethoscope,
right,
losing your hearing is kind of a problem. And so thankfully, I have a very talented ENT group in my area. They got me in immediately. They tested my hearing. We did steroid injections inside my ear. I took them orally. It turned it around, but I was left with chronic tinnitus. So I had chronic ringing in my ears. And it was so significant and so troubling that I started saying to my husband, I can't live like this. Like, it's almost like I have the ocean in my ears all the time. And at that point, they were like, well, maybe we should try hearing aids. And that was...
And you're how old? I want to set the scene. So you're...
42, 43.
42, 43. You're working in conventional medicine, and there's this moment where you want a broader view. And traditional medicine isn't supporting you in that.
No. And I mean, and to be clear, like this practice, if I could tell you the kind of hours that they allowed me to work, and they were like, we will accommodate anything. Like, we just want you to still be with us.
They loved you.
Yes. And I love them, and I love everything about the heart. But I got to a point where I wasn't growing anymore. And I said, it's not you, it's me. I'm not intellectually growing anymore. And that to me is something that I've come to realize is really important, that I have to honor that side of me that really loves to learn and always wants to be learning. And so 9 years ago, I left traditional medicine with no business plan, told my husband, I was like, I woke up one morning, I was like, I can't do this anymore. And, kind of took this, leaped off a cliff and said, I know I'm going to be successful. And I thought he's told me now, he said, I thought you were having a midlife crisis. And so I kind of found my footing pretty quickly. But I think for a lot of people, the biggest takeaway is that this healthcare hiccup, these symptoms that my body was demonstrating to me were showing me that word pause that we don't reflect enough on was something that I needed to start focusing in on. And so intuitively listening to what the universe or God or whomever else was telling me to do, it was like, it's time to shift, it's time to pivot, it's time to do something different. And so I sit here kind of humbly saying, I'm so glad that I did that, because I wouldn't have opportunities like this today if I were still, I can't imagine what I would be doing. I would not have stayed in that environment. But for me, I needed to spread my wings and be able to impact more people than my amazing patients that I had the privilege of working with for, over 20 years.
I'd call that an initiation. You were in some ways forced by your biology, this perfect storm of the symptoms that came up. It sounds like there was a gap in meaning, even though you did have a lot of meaning working for this cardiology group. So you were forced into a role change and a code switch.
Completely. And I think, for anyone that's a healthcare provider, we aren't taught business. We aren't taught anything related, marketing, advertising. We're not taught any of that. And so within a few months, the best thing, I've always been a believer in investing in myself. And so I hired a business coach. It was one of the best decisions I ever made. It turns out that person who was my business coach then now has a 9-figure business. I mean, she has a blown up business, but she gave me tools, things for me to do to move my business forward. And so with each step forward, it was just kind of like it was like a steamroller just moving itself forward. And so, starting with group programs, starting with one-on-one programs. And this is even before I got interested in doing diagnostic testing in the integrative functional medicine world. But I just got more curious. I was like, what are the clues that I'm starting to see with these patients that are different than what I was seeing before? Because now I'm looking through a different lens. But it's giving women permission to consider that there are options beyond traditional allopathic medicine. And the irony is, how many of my former colleagues started referring people to me? They're like, our patients are hearing great things and they're doing, you can do this role with them and then I can continue the work I'm doing, and kind of finding a way to create a niche where it was clearly very much needed, but also kind of honoring this desire to devolve from where I was before. Like I always say, I'm so grateful for all those experiences because it allows me to sit back and sometimes reflect on, as I'm sure you can, humorous things that you've seen or funny things or environments where you've just been in complete awe of the process of just being in a position where you're helping people, sometimes through the worst days of their lives. And then all of a sudden you're like, wow, I can still continue helping people, but I'm doing it at a different level. I'm doing it in a way that feels much more in alignment with where I am in time and space.
I hear a really important thread in what you've just described of the bridge that you built. So you didn't blow up your work in traditional medicine. Instead, you learned there was this gap. There was a way in which you could uniquely serve that was in deep alignment. And you built that in a way that invited the value that you were adding to the more conventional approach that you had been in. So I want to circle back to that bridge, but I want to dive deep on alignment because I feel like alignment is a big part of burnout, especially for women who face this perfect storm of young kids, hormonal changes, progesterone is not what it used to be, anti-Mullerian hormone is starting to drop. You've got mitochondria that are not performing like they did in your 20s and 30s. And alignment, purpose, and meaning becomes incredibly important. So I have to ask, since you had a social media post about biomarkers today, were there any biomarkers that you wish in retrospect you had measured back then?
Oh, without a doubt, fasting insulin. Because, being in cardiology, there's so much metabolic disorder and disease. And it was starting to kind of come on my radar, but there was so much pushback from my peers. Why would you test that?
Oh, I know.
Why is that important? And I said, because we can predict way ahead of time. I would have been asking my female patients, did you have preeclampsia?
Yeah.
Did you have PCOS? Do you have PCOS? Did you have gestational diabetes?
Yes, all the non-traditional risk factors that are not on that list that cardiologists talk about.
Correct. And it also would have given me tremendous insights into my older female patients. Why are we seeing so many arrhythmias? Why are we seeing so much hypertensive cardiovascular disease issues as they're navigating getting older? This was WHI came out in 2002, and I finished my nurse practitioner program at the end of 2000. So I'm really dating myself when I say that, but I saw a whole generation of women taken off of their hormone replacement therapy.
Me
and they
too.
would cry in my office, and I felt so bad, and my team would say, stay in your lane. You have no business talking about hormones. That's what I was told. So I think that fasting insulin would have been high on the list. I think that, certainly we were doing lots of high sensitivity CRPs, but, if I had had the option of doing Lp(a) back then, the biomarkers that I think of now that are so critically important to have as a litmus test of not only metabolic health, but overall health, as well as cardiovascular disease risk, because the number one killer of women is heart disease.
Absolutely.
And it would be so much better if we could be way ahead of the curve prior to going into menopause, when we know sets us up metabolically for, just about every organ system disease that you can imagine.
So we're going to weave in some science moments here. You talked about fasting insulin. When I was in mainstream medicine, I got so much pushback for some of the tests I was running, like fasting insulin, 2-hour glucose challenge test with insulin and glucose every 30 minutes. I got pushback for running free T3 and total T3. And yet we know from the literature, even though this doesn't really filter down to mainstream practice, that your postprandial insulin changes 7 to 14 years before your fasting glucose changes. So we need these biomarkers. We need to look under the hood, especially for women, because the research is biased against women. And I want to also dive deep into the burnout phenotype. So these are so helpful. Fasting insulin, high sensitivity C-reactive protein, lipoprotein little a. What about for the burnout piece of maybe that lack of alignment? Mm-hmm. How can we measure that?
I mean, I think there's several different ways, and obviously every patient is an individual, but common themes that I will say is cortisol issues.
Yes.
So, sometimes the cortisol can be sustained for a period of time where it's high and then it becomes very low. And that's generally when women will describe, I'm exhausted, I can't get out of bed.
Burnout.
Yes. Thyroid related issues. So you'll see very depleted free T3, oftentimes free T4. You may say high reverse T3. I also think a great deal about, this blood sugar dysregulation pattern that you're seeing where women will say, doesn't matter what I eat, I'm hyperglycemic, which then translates into hyperinsulinemia. So I think that it's a pattern of multiple things, but those are typically, like if I'm looking at a broad stroke, those are typically the things that I will see that are red flags.
Super helpful. And I think a lot of folks get confused about mitochondria. They hear about mitochondria, they hear about all the supplements that are purported to help with mitochondria, but they don't know how to measure it. Mm-hmm. And one of the indirect measurements is to look at your metabolic flexibility, to look at your insulin and glucose. So I think that's such an important part of this. And, part of the perfect storm of women who are 35 or 40 or older is that your metabolic flexibility starts to decline. Mm-hmm. And it's not just going to show up with your body composition and gaining more body fat and losing muscle mass. It also shows up in the brain, mm-hmm. right? With cerebral hypometabolism or this mm-hmm. loss of mitochondrial function as estrogen declines. So I appreciate this point about glucose metabolism. Anything else you would add to these biomarkers, like a way of kind of tracking burnout so that you can assess it before it becomes a serious problem?
I mean, I think one of the easiest ways, if you have an ability to measure your HRV, so if you're looking at Oura Ring, Whoop Band, I mean, those seem to be the most reliable ones that I'm personally aware of. And so a lot of times I'll have my patients, I want to know over the course of a week, what's your average heart rate variability? That may seem trite, but I find for myself even, looking at what is the impact of travel? What is the impact of stress? What is the impact of where you are in your cycle if you're still getting one? What is the impact of jet lag? What is the impact of overtraining? What is the impact of late night meals? And so I think that can be another objective way to look at things. It also gives people this is my baseline. This is where my heart rate variability normally is. Personally, I'm in the 50s to 60s. If I'm in the 20s and 30s, I'm either sick or I'm jet lagged. Yeah. And so it just reinforces that. The other thing that I would add to it is heart rate, just overall heart rate.
Resting heart rate.
Resting heart rate, because if you're dehydrated, if you are jet lagged, all the same things apply. If you're overtraining, not recovering sufficiently, I'm normally in the 40s and 50s. If I'm hovering in the 60s, I'm either sick, I'm dehydrated. So I think for each one of us, that can be another objective measure that we can discuss with our patients to allow them to have the ability to track. I also like to look at continuous glucose monitors. I'm a huge proponent of those.
Yes.
Obviously, thankfully, they're coming down in cost. For a while there, they were almost prohibitively expensive, I think, for most individuals. But again, building awareness around what's your blood glucose like during your cycle, during stress, when you have a late night meal. All these same, if you overtrain and you don't recover enough. And so I think these are helpful because patients can gauge awareness around how these things impact them as the N of one. But it also allows me to look objectively, because I think sometimes, and I'm sure that you experience this as well, when I'm unsolicitedly giving advice in a situation and I'm helping someone understand your desire to do Orange Theory Fitness 5 days a week is no longer serving you. Well, let's track the data. Objectively, let's look at it. Let's see, what's your hunger and satiety cues? What are they telling you? So helping them understand if you are not recovering sufficiently, and we know that over time you're eroding, being able to have healthy cortisol, healthy insulin, healthy glucose metabolism. On top of that, layering in, what are you doing to your sex hormones? Because the prioritization in the body is always to prioritize survival over reproduction.
That's right. Cortisol over estrogen and progesterone and testosterone.
And so when I see women that are like 40 with really low testosterone, and we've excluded the possibility that there might be something genetically contributing to that low testosterone, because I do have some patients that that's just part of their genetics. And if we've already ruled that out, I'm like, what are the most common reasons why we have low testosterone? And so I'll ask them, do you know? Stress, exposure to estrogen mimicking chemicals, et cetera, all these things can deplete insulin resistance. I mean, all these things that can worsen, low sex hormones. It helps them understand that stress is designed to be their friend to a point, and then chronically, habitually, over a long time, it's not going to benefit our health. And certainly not. Again, I always say to patients, perimenopause, menopause, period, like the word pause is so important for us as women to process. It is a time in our lives to reevaluate everything in our lives. As painful as that can be, what no longer fits. It's like trying to fit a square block into a round hole. It no longer fits. The universe, God, whoever is telling you to shift.
That's right.
If you're paying attention and listening.
Yeah, it's this is what I feel is the initiation. And it's also I feel like there's this ability to create a better half a life.
Absolutely.
That comes up in your 40s
Yeah.
and your 50s. There's a way that if we have another science moment, there's sex differences here too, right? So when we look at fasting glucose, we know that lower levels of fasting glucose in the prediabetes range are associated with more vascular dysfunction in women compared to men. So levels like I used to have of 105, 110, 115 milligrams per deciliter on fasting, which you can see in a comprehensive metabolic panel, kind of a basic test that a doctor does, but you can also see it on a continuous glucose monitor in a more helpful way. And all of these things are interdependent, right? Like I think the cortisol affects your insulin. The cortisol raises your blood sugar. It affects your immune system. It modulates the other sex hormones, as you're talking about. It can affect your thyroid function. And it certainly affects your heart rate variability.
Yeah.
So I want to ask you, because I love going personal with you. You talked about your HRV. What have you learned about HRV over time? Like, I just went to Costa Rica and my HRV is like up in the 70s to 80s every time I go. There's something about the aliveness, it's just teeming with aliveness there, the soil. What have you learned about HRV? Like what helps you?
It's such a great question. For me personally, sleep, like really high quality sleep.
Yeah.
Managing my stress. And this is coming off of probably one of the most stressful, hardest years of my adult life. The other thing is really dialing in on nutrition.
Yes.
I would say just having joy, like just being happy. When I was away with my family, so my husband and boys and I were away for 2 weeks, and I was showing my husband, I was like, just so you know, I'm not just saying this. And my husband's looking at my Oura Ring metrics. And I said, look at my deep sleep. It's 90 minutes at home. It's 2 hours here.
Yes.
And why is that? It's because I don't have to get up like really early in the morning. It's because I'm around the 3 most favorite people in the entire world. And I love learning and I love traveling with my family. Like as a family, I love that. But I think that
I love how this maps to social longevity. So we're going to talk more about health span. And I feel like you're speaking into a formula that really works for you. Being around your favorite humans, having this more relaxed schedule, how that maps to a better HRV.
Yeah.
And probably a longer health span.
Yeah. Well, and I think the one thing I've learned, and I'm an introvert, my husband's an introvert, 1 out of 2, one child is an introvert, 1 is an extrovert. So we all exist in this space. And it's the understanding that for me, having downtime is essential. I can be on a stage or I can be on a podcast or I can be, doing things for my business, but
15 million views of your
It's
TEDx talk on YouTube.
It's a little terrifying. That story around that talk is also interesting. We can talk about that. But I think when I'm like the rubber band, When the rubber band gets stretched too much, that's when I can just feel like that undercurrent of, that I feel a little, I always say it's like I almost feel a little fidgety. And I think it's because of that cortisol is not balanced. So I think the things that I used to think were really cool in cardiology when I would have a patient circling the drain, and I mean that seriously, like I would call in a helicopter to transport a patient because some hospitals didn't have cath labs and my doc wasn't there and I was doing that all myself and helping to resuscitate a patient. I lived on that.
Yeah.
I loved that. And now I'm like, I need a lot less excitement in my life.
Okay, so let's drill down deeper on this because, everyone who's had a difficult childhood had a unique experience. You and I have had some difficulty in our childhood. We've connected about this. And there's a way that the rev and kind of the pace that I created for myself as a kid is something that I recreated, especially early in my career. So working 120 hours a week on the floor at UCSF or at the Brigham or Massachusetts General Hospital, there was a way that felt very familiar to me because it's the way I pushed myself. And I think midlife often gets us to question some of those patterns that we've embedded in our system. So tell me about that, because it sounds like you're describing a high state of rev, like that level of responsibility and choosing whether to transfer a patient and trying to find the cath lab and you don't have the doctor there to back you up. Like that is a cocktail of cortisol that probably echoed something from childhood.
Absolutely. Well, I think for me, in my childhood, if I achieved, then my parents kind of left me alone.
Yeah.
And so for me, that translated into how I looked at college and how I looked at graduate school and how I looked at, like, I'm going to pick the most unpredictable, to me at that time, the most medically complex patients. And I was a reformed adrenaline junkie.
Yes.
Like, I liked walking into chaos in a work environment because I knew how to control that chaos.
You were familiar with it.
Correct. And so, that was my pattern for years and years and years until it no longer served me. And I jokingly say to my husband, the irony is that I've always had a really strong friend network throughout my lifetime. I may not have understood relationships with men, and that's a whole separate conversation. But for me, that really strong social network kind of provided the springboard of curiosity about these environments that I was working within. But it just got to a point where I felt like, number one, I no longer had to prove myself by picking the hardest thing. And number two, I just didn't want that anymore. I wanted less stress, less drama, less reactivity. I sensed that I needed to quiet my autonomic nervous system as opposed to fueling it. And even now, my kids will laugh at me, but sometimes it'll kind of squeak out on occasion. And they're like, "Mom, you're doing it." And so I have to kind of say, "You're right. Thank you for bringing that to my attention."
It's so good to have that accountability. Like to educate your children in that way.
Yes.
Like that feels to me when I see these moments with my daughters where they recognize some of these patterns that I'm trying to heal from, but still eke out. It feels like, oh, wow, I'm modeling for them a different way.
Yeah, absolutely.
So good.
Absolutely. So I think it kind of lends itself that we develop these patterns to deal with what we grew up within, and then we get to choose what no longer serves us. And so I think the most valuable thing that I've taken away, like I'm so grateful that I had those experiences because it made me who I am today.
Yes.
But I also have the ability to now choose what kind of environments I choose to work within, be within, align within. And I've very much gotten to a point, and I encourage anyone listening, that when you get to a certain stage in life, it's either a hell yes or it's a hell no. There's
no in between.
Right. If I make the decision that quickly. I go intuitively, what is my gut telling me? And that is it. I don't overthink things. I think that has been very helpful for kind of ensuring that the second half of my life, the trajectory of this life, is incredibly thoughtful.
That's hot. That's totally hot. Okay. So I love this concept of the whole body yes, which is what you're describing, the hell yes. I learned about it from Diana Chapman, who was one of my coaches, as well as Katie Hendricks, a therapist. What are some of your whole body yeses right now?
Oh, I think it's spending time with people that I feel good around. And I know that maybe sounds trite and simplistic,
No,
but
it doesn't.
I think that when opportunities within my business or otherwise come about, I'm like, that's either an instantaneous, yes, I want to be around that person. I feel good when I'm around that person. I feel like they contribute to my evolution as a human being in a way that is very much in alignment. I would say, other things, I'm just an explorer by nature. Like, I'm sure if someone did like a past life regression, I probably was an explorer because I love being in new places and trying new foods and being in different, doesn't necessarily have to be a different country, it could be a different city. And so it's that exploration of not just myself, but the world in general, that brings me great joy. And I would say the other thing is getting really clear and intentional. I'm getting ready to be, next year we will be, whether you call it the open door or the empty nest, however you want to frame it, it's an evolution of me as a woman, to go from being like primarily focused on raising my boys to being in a position where we're kind of pre-launching them. They're not 100% independent, but getting to that point. And what does that mean for me? My relationship with my husband, we've been married for almost 23 years.
Yeah. What does that mean for you?
I don't know. Todd and I talk about that a lot. What is our a lot more free time going to look like?
Yeah.
And so it's kind of settled into creating more passions or things that we're interested in. Like we just started playing pickleball, and I initially started doing this because I was like, it's so good for our brains. We should do this. And now we've become, my husband's like a vicious competitor.
Yes.
So I humbly sit back and say, okay, I may still be better with hand-eye coordination, fine motor skills than he is, but he is a vicious competitor. So it keeps me on my toes. But also the travel piece. What do I want my business to look like? What are the things I want to focus on? How tangential do I want to be in my business?
Yeah. What are the answers? What do you know about those questions?
I think that for me, it means not working with as many people. And that was a really hard decision. I mean, that is
team-wise or bigger
patience.
Yeah.
So that was a really hard decision to make because I was on the precipice this year. Like, was I going to dive back into doing more? And I decided that if my goals are to do, these two things in my business, then that's not in alignment. So I have to kind of, I'm still working with some people privately, but we're kind of whittling that down. And that was a big decision to make. I think that for me, I love podcasting. Yes. I love being able to interview incredible experts and share their journeys, their experiences, their riches of information with my community.
You're so great at it. I mean, there's a way that you bring this deep presence, like a deep healing presence to your podcast. And it's not, there's so many podcasters, I won't mention names, but they happen to be XYs, where it's all about, sort of like you're lucky if you're a fly on the wall. Mm-hmm. Whereas with your podcast, it's much more about how do we center this on the listener? And I really appreciate that.
Oh, well, thank you. I accept that wonderful compliment. I think for me, it's always about that curiosity. Like, I love to learn. So that's number one. And then I love to be able to take, in many instances, very complicated information and make it accessible. Like, how can a woman in perimenopause and menopause take this information away and advocate for better care, advocate for themselves personally and professionally? And ultimately, that's, like, I feel like that is such a gift. Like, I feel so appreciative and grateful that the podcast has resonated with so many people that it's something I'm really proud of. Like, I think about it from a place of this is something we grew truly organically.
Yes.
And have gotten to a point where I have the ability to interview incredible humans like yourself, as well as many others. And the thing that's interesting to me, Sara, is that on a very deep level, as I have healed myself, I've brought in more and more experts that are allowing me to show up in a different way. Yeah. It's very easy for me to interview another clinician and ask them all the questions about XYZ disorder. It is much harder for me to interview someone talking about feelings.
Yes.
Because I have to realize, like, part of my healing is being able to ask those questions, talking to Gabor Mate, his book was really hard to read for me.
Sure.
But during that conversation, we focused a lot on my dad, and he kept saying, can you understand and appreciate what kind of trauma your dad went through that created this alcoholism?
Yeah.
And it was like just this profound opportunity to sit there and say, you know what, you're right. And allowed me to see my father in a different way. But I think in many, many ways, the beauty of being a podcaster, if you do it for the right reasons, is that you really get the opportunity to interview all these experts, but also in many ways, heal yourself through the process. Like that was never the intention, but that has been part of what I've learned as a podcaster is like, wow, like I get to ask these incredible questions, but it also forces me to deal with my stuff.
It does. And I see the flush of emotion that comes up as you talk about your father in this interview with Gabor Mate.
Yeah.
It's this profound opportunity. I mean, I love that intersection of, I'm obsessed with the gene-environment interface, but bringing in feelings and emotions and how they're such a critical part of the biomarkers,
absolutely,
the state of health, the state of your health span. It's it feels like the piece that's often missing. Even with the current rise of all of the content producers on perimenopause and menopause, I feel like there's a way that it gets reduced down to hormone therapy.
Yep.
And it needs to be so much broader than that.
Well, and I think that's what makes your voice so unique in this space. And like I said, when the student is ready, the teacher arrives. And I feel like your last book, for me, put so many pieces together. I was like, wow, wait a minute. All these pieces start to come together. Autoimmunity, this reactivation of this pine network. Why, to your point about if we just slap a patch on someone and give them some oral progesterone, it's not going to fix all this other stuff. Like it's much easier to just take medication.
Yeah.
It is much harder to do that internal work. So when women come to me and they'll explain, this is what I'm dealing with, almost always some component is weight loss resistance. And I'll say to them, we can run all these tests, but if you have stuff you're not dealing with, and I was like, I speak from personal experience. Yeah. I will be in some form of therapy for the rest of my life, inevitably, because it's almost like you scratch the surface and you realize there's so much more that's there. And I think as we heal ourselves emotionally and spiritually, that's when all of a sudden things seem to fall like neatly and conveniently into space. What I think is interesting is it's much harder to do that kind of work for the individual.
Yes.
Much harder. And not everyone's in a position where they're accepting of that, willing to do that.
Or ready for it.
Or ready, most importantly, ready for that.
Such a good point. I'm trying to think whether there's anything that we disagree about, because I think that makes for kind of a fun process. But I want to talk about burnout a little bit more. And you told us the story about the burnout you experienced at 42, 43, which is such a common age, right? 43 is when estrogen starts to wildly fluctuate or decline, and mitochondria are faltering, especially in your eggs, your oocytes.
Oh, they were in the toilet.
Yeah. So with burnout, I just want to give a quick definition and see if you agree with this. Burnout is a syndrome that represents a prolonged response to chronic interpersonal stressors on the job or in caregiving, or, maybe you're taking care of young children like you were, like I was in my 30s, or taking care of parents. And it's characterized by three core dimensions. First, emotional exhaustion, feeling overextended. Second, depersonalization, or a sense of cynicism. I think we're having a lot of that right now in our culture. This indifferent attitude about what's happening around you. And then reduced personal accomplishment, a decline in feelings of competence and successful achievement in one's work. So this model was developed by Christina Maslach, and she's got a Maslach burnout inventory that we'll link to in the show notes. But burnout is also not something that we diagnose in clinical medicine, even though the World Health Organization describes it. And there's an ICD-11 International Classification of Diseases code for it. So with burnout, I think about our most vulnerable populations, and that includes nurses, doctors, teachers, people in helping professions, people who experience racism or violence. As you look back on the burnout you experienced, and we talked about some of the biomarkers that go with that, do you now track some of those biomarkers like in a more prospective way to try to prevent that pre-burnout or burnout?
Yeah, I mean, that's such a great question. Yes and no. I think that, when we're looking at, like, as an example, I like to look at the distribution of saliva cortisol over a 24-hour period of time. And so we can look, I always say to patients, here's your reading from 2023, here's 2024. Clearly something's happened. What can we look at objectively? I think it can be helpful because someone may feel different and their labs may suggest otherwise. And so I think that it can be both confirming. It can also be, helpful to say, okay, this may not be the primary reason why you're feeling poorly. There could be something else that's going on. I think in many ways, burnout is not given enough emphasis. I think that women are expected to be Energizer bunnies, be selfless, be going all the time, be giving to everyone all the time.
Well, we power the economy.
Yes, exactly. And I look at how many, women I interact with sometimes that are late 30s, early 40s, and I can sometimes predict the people that are more likely to end up being really burned out just by virtue of what they say to me. They're the selfless people that never sleep, that are, if they're working out at all, they'll say, I can only manage to walk, or, I'm eating fast food 6 days a week, or, I'm the sandwich generation where I've got aging parents and teenagers. It's like they're pulled in so many different directions. It's almost like a perfect storm of burnout. But I think in many ways, not enough of us are looking for this. And not enough of us are talking to our patients about it because we as women are expected to still perform regardless of how we feel. That's why women oftentimes get diagnosed with disease states much later because they don't want to take the time to take themselves to their healthcare practitioner, or they present late in the emergency room because they had 5 other things that they needed to do. So I think giving women permission to advocate for themselves, I think, is kind of this first step. And I think for many women, they struggle with that. They struggle with the ability to say no, have boundaries, or maybe they don't have, if they're a vulnerable population, they don't have the flexibility to take a nap. They may have to work 2 or 3 jobs. They may be in a situation where financially that's the only way things work. It's the only way they put a roof over their heads. And so I think screening is important. I think it's also really important to be aware of, what are the confounding variables? Many of us have talked openly about how many of my friends made changes in their marriages in their 40s.
Yes. Divorce spikes for women.
I think
especially
they find their voice.
40 to 50, 45 to 55.
Yep, they find their voice. My best friend from college never liked her husband. When she called me to tell her she was getting divorced, I was like, I was so sorry to hear that because I know that's stressful. But on the side of my head, I was like, thank God he was I think he's made her miserable for 20 years. But, how many
and it affects your biology.
Yes. And now she's remarried and very happy, and I'm thrilled for her. But she said to me, why did I waste so many years with him?
Yeah.
And that just broke my heart.
Yeah. I'm curious about the deep dive you've done with Thomas Dayspring and maybe the interface of burnout, women who overfunction, put together with this cardiometabolic change that happens after 40. How do you like to measure it? So we talked about these other biomarkers, HRV, high sensitivity C-reactive protein, fasting insulin, postprandial insulin. What about with cardiometabolic function, more specifically, like advanced markers of coronary heart disease or heart disease in women?
I mean, I think the one thing that I've learned from many, many conversations with Tom Dayspring is I say collectively as a medical community, are doing the wrong tests.
Yeah.
And so number one, every single person listening should have an Lp(a) done once. 20% of us as a broad-based community have elevated Lp(a), and that's genetically mediated. If you're African American, it's 50%. And if yours is under, within the low range, which is 30 milligrams per deciliter, you never have to check it again. It's a one and done. Apolipoprotein B, ApoB is the other one to be looking at. But I think Lp(a) of the two is the one I think is most significant because it is an independent risk factor for heart disease, and it is 7 to 8 times more atherogenic than an LDL.
Yeah.
And what do I find when patients show up with me to labs, or we have, Ask Me Anything podcast episodes? They'll say, my healthcare provider did a lipid profile, and my total cholesterol is high, my LDL is high, my triglycerides are 150, 180, and my HDL is low. What do I do? And I always say, well, there's a couple things you can do up front. Those triglycerides should be under 70 milligrams per deciliter. What do we say in conventional medicine? Under 50. You already have some degree of blood sugar dysregulation, insulin resistance by that point. I think what is a greater concern of mine is those two biomarkers I just mentioned, because that gives you a better sense. It doesn't mean that a high LDL is irrelevant. That's not what we're saying. If you have a high LDL, you very likely have a high ApoB. With that being said, I think for a lot of individuals, it's like we could have known at 25 or 30 that someone has an elevated Lp(a), which means it's even more important to be ensuring that metabolic health is emphasized way ahead of pregnancy if they haven't yet gotten pregnant, way ahead of being in perimenopause. And so when I think about like cardiovascular disease risks, we focus a lot on, the conventional ones: hypertension, diabetes, smoking history, being sedentary. But these other biomarkers, and we know that Lp(a), there's very little that will lower that effectively unless it's medical drug therapy. And some of those drugs are very expensive. So I think I would rather know sooner rather than later. I didn't know until 5 years ago that I have the perfect genetic brew for high Lp(a), high ApoB. But I think for a lot of people, it would allow them to make different decisions. And that, I think, is really important.
That's potent. It's, I was taught when I went through my medical training that with nutrition and lifestyle changes, you can improve, at that time, LDL by 15%. And what I've seen over and over again in my practice is that you can actually move the needle much more with lifestyle and nutrition. And Lipo(a), it feels like we're still at the learning to crawl stage with understanding how to modulate it. I did a 2-year fellowship with Mark Houston, and I learned about Arona berry and some other strategies to help with Lipo(a). And I see it effective in some people, but not all.
Yeah.
I think there's these subpopulations.
Absolutely. And that's where bioindividuality plays such a huge role. I mean, there's an interesting paper that came out fairly recently looking at ways to modulate Lp(a). And one of them is actually hormone replacement therapy. So estrogen.
Yes.
Women will say,
point.
oh my goodness, when I was 30, I had this checked, and 40 and 50, all of a sudden my lipids fell off the bus. Like the wheels fell off the bus, and now they look terrible. And it's really interesting. The research certainly suggests that oral estradiol is superior to transdermal, but transdermal is not bad. And I think that's where that bioindividual piece certainly plays a huge role. So that's certainly, I think for a lot of women, myself included, one of many reasons why I will be on HRT forever. I think the other thing is, to your point, things like saturated fat. If you have apolipoprotein B that's high, saturated fat is something that you should really that's why for me personally, when I'm working with patients, if they have an elevated ApoB, and we've done other Boston heart tests, and we can talk about that. But I think it's very, very important to help them understand, those really fatty choices of meat and fish and poultry, like those probably aren't the best choices for you. It doesn't mean don't eat the protein, just eat leaner cuts of meat and fish and poultry. And the irony is when I did a cholesterol balance test through Boston Heart, I was shocked to see, well, not shocked, I guess. I'm a hyperabsorber of cholesterol.
Yes.
And so because of that, it explains why if I ate really, really fatty foods, I always felt bad. And it's because my body just sucks it all up. So I think for people to understand, there's different ways that we can look at these lipids. We can modulate with nutrition and lifestyle. That's certainly important. I think the other piece is there's also a lot of pushback about certain drug therapies. And I'll just throw this out there, statins. I prescribed thousands and thousands of statins over the year, but we know that there are markers that may help us better understand the individuals that are more susceptible to the constellation of side effects that they can get from a statin. So desmosterol is a lab value that we can kind of monitor to get a better sense of the individuals that are going to be most susceptible to especially the cognitive side effects that we see with statins. And so I think for me, it's understanding these things, and I didn't know all of these things 15, 20 years ago, that now I can look at cardiovascular disease risk, longevity, and from a different lens, and be able to do it in a way where it's still actionable for people to be able to make their choices. It's always that informed consent conversation. Like, here are the best options. Some of them may not be financially feasible because those PCSK9 inhibitors are very expensive still.
Yes.
And I don't foresee that they're going to get less expensive, especially as the technology is evolving. It's so new. But I think for a lot of people, knowing that it's kind of like it's like an hors d'oeuvre platter. It's like you can pick and choose like what resonates with you, what works for you, in conjunction with your healthcare team to figure out, what you need to be doing to ensure that you're lowering your risks of, as we like to call it, ASCVD, heart disease.
Yes. Well, Cynthia, I feel like I need you to come back so that we can go deep on heart disease in women. What some of the differences are that we know about and the ones we don't know about. I want to also talk more about the microbiome and the gut and how that maps to metabolism and cholesterol. You talked about being a hyperabsorber. So we're going to have to put a pin in that for next time. As we wrap up this podcast together, any final words that you want to share with us about burnout, about some of the metrics that you think are the most important? Anything at all?
Yeah, I would say if you think you're burned out, you probably are. And the good thing is it's not, it's not linear. It's not a forever situation. There are things that you can do that can certainly improve your quality of life while you're healing and help you set things in place to ensure it doesn't happen again. I think that for so many of us, we're just going so fast, so hard for so many years that we're in it before we realize it. And now, and I'm sure for yourself, I know for me, the signs that I am starting to slide a little bit, the HRV will go down, my heart rate will go up. I won't recover from exercise as well. I won't sleep as well. And so that allows me the opportunity to course correct. Whereas before I just didn't know any better. Now I do. And I try to teach my patients the same thing.
Yeah, that's so good. Well, as you know, my next book is about biomarkers in women. And
so excited.
What's the measure of a woman? What should we be measuring that is especially insightful in women compared to men? So love this conversation with you. Thank you so much for coming all the way to the Bay Area to be on Treated. I love the time that we get to spend together. Thank you.
It's an honor.